The news day continues here on One News Now. I'm Riza Diaz. The health department is set to roll out the fourth dose or second booster shot of COVID-19 vaccines on Monday. JC Cosico has the report.
Due to waning efficacy, government will begin the rollout of the fourth dose or second booster shot of COVID-19 vaccines on April 25. But this will only cover the immunocompromised aged 18 and above. The health department says they may get jabbed as early as 3 months after their first booster.
Humihina po ang bisa ng ating mga bakuna makalipas ang panahon, kaya naman booster shots are very important.
DOH will use vaccine brands AstraZeneca, Moderna, Pfizer, Sinopharm, and Sinovac for the rollout. Senior citizens and health workers, meanwhile, might still have to wait for their turn, pending the recommendation of the Health Technology Assessment Council.
Mas kumpleto ang ebidensyang hawak ng ating HTAC for the immunocompromised. So minabuti ng kagawaran ng kalusugan, iuna na natin.
To date, 95% of frontliners in the country are already fully vaccinated, but almost 50% have yet to be boosted. DOH attributes this low turnout to complacency amid decreasing infections.
Kalaban talaga ng successful vaccination programs, itong tinatawag na pagbaba ng kaso.
With this, the government has started conducting special vaccination days in areas with low inoculation rates. Starting in Soxargen, Negros Oriental and Occidental last April 20 until Friday, while Bicol Region and Palawan are set to have theirs on April 25 to 26. DOH reminds the public against complacency as the virus is still very much present.
Let's take advantage of this lull na bumababa yung kaso at magpa-booster na tayo at alam naman natin mapagsamantala ang COVID.
So far, over 67.3 million Filipinos have been fully jabbed against COVID-19, while some 12.7 million have received their booster shots. For News 5, JC Cosico, we are One News.
Some 7,000 Filipinos are expected to receive their second booster shot on the first day of the rollout tomorrow. Let's get more details on this. We have Health Undersecretary Ms. Mirna Kabutahe is joining us over the phone. Yusek Kabutahe, good afternoon.
Good afternoon, Ms. Rita, and to all your viewers.
Yusek would like to know how are the preparations going so far for the rollout tomorrow, and how many vaccination sites have been put up for this?
We have done our orientation for our implementers nationwide. We had several batches yesterday and today. The only difference with the rollout of the first booster or the third dose is the definition of our immunocompromised populations and the vaccine brands that will be used. Otherwise, the processes will be the same as the third booster. In terms of the vaccination sites, all our vaccination sites may administer the second booster considering their brands and their allocation. So we can do it including our medical clinics, our private clinics, our hospitals, and especially for this immunocompromised, we can use our HIV treatment hubs for our people with HIV and AIDS, and we are allowing house-to-house inoculation for those who are bedridden and with those with very poor prognosis at home.
Ma'am Mirna, how many health personnel have committed to administer the fourth dose, and are we facing with that issues regarding the number of personnel for this?
We will use our regular vaccinators. They are all ready, no? The strategy can be to have a separate, just a fast lane for the immunocompromised. They can administer side by side with the other vaccinees for the first dose, second dose, and booster. There is no problem so far with personnel to date because not so many are coming for vaccination already. So it's the problem more really of the acceptance for the booster shot.
Ma'am, do we have a time frame as to when we can expect the recommendation of the Health Department or the Health Technology Assessment Council, for that matter, for the second booster shot of health workers and senior citizens?
As has been mentioned earlier, they're looking at other data to be able to give a more comprehensive recommendation. So let's give them time to do the studies, and I'm sure they'll be ready to come up with a recommendation as soon as they have completed their discussions.
Ma'am, we know the health department is having special vaccination days, of course, in areas with low turnouts of a booster. How are the preparations going for that? And also would like to find out, are we also seeing perhaps a positive response on these vaccination days?
Yes, we have resorted to house, special vaccination days for low turnout areas so that we can improve their coverage. In our experience, in many areas, there are high-yield areas. There are areas where they have not gone before and people are responsive. But you are correct. There are also areas where the response is not very good. There is passive response. So the health workers need to go back again to convince them to be vaccinated. So we have deployed several teams, but the turnout in many areas is not that good.
All right, thank you, ma'am, for giving us those updates. That was Health Undersecretary Ms. Mirna Kabutahe. And we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The Bangko Sentral ng Pilipinas and the National Police have formally filed a criminal complaint against a TikTok user who was filmed burning a 20 peso bill. The BSP announced that the move on its website, saying alias Jam Haren violated the Presidential Decree number 247, which prohibits the defacing, mutilating, tearing, burning, or destroying of the Filipino currency. The central bank said it will pursue the case until conviction. Now, the now viral video shows the suspect using a 20 peso banknote in igniting the content of an alcohol bottle. If proven guilty, he would face imprisonment of up to 5 years or a fine not exceeding 20,000 pesos. Let's now take a quick look at today's other top stories. At least 210 fresh COVID-19 cases were recorded on Saturday, bringing the country's total caseload to above 3,680,000. Some 61 new deaths were also logged. The health department says some areas saw an increase in infections as mobility intensified during the Holy Week. Meanwhile, another oil price hike is set to be implemented on Tuesday. DOE Oil Industry Management Bureau Director Rino Abad, however, did not disclose the amount of the increase to avoid influencing oil firms on the price hike. And Russia continues its attempt to crush the last Ukrainian defenders at a steel plant in Mariupol, days after Moscow said it did not need to take the plant. The Ukrainian government, meanwhile, says the United States Secretaries of State and Defense are set to visit the country as Russia's invasion enters its third month. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.